the last presentation for the afternoon is Victor from Care.Coach. And
Hi, I'm Victor, founder and CEO of Care.Coach. At MIT, I was working on a clinical trial about human performance for NASA's teleoperated robotics program. I read a paper about the risks of astronaut isolation and loneliness, and realized that my grandmother living by herself in Taiwan was becoming very lonely. Ironically, while I was working with cutting-edge technology, it was challenging for my mom just to get grandma set up for the occasional Skype call. So with them in mind, I built a teleoperated avatar to solve social isolation.
I needed a lot of help sometimes.
Bill Langlois is not as mobile as he used to be, and when his wife is away, his only companions are his cats, Boots, Sneakers, and Socks.
Hello, Socks.
Obviously, one of these is not like the others.
Because she's my friend. I talk to her like I talk to my family.
Socks is a healthcare avatar.
She calms me down, especially if I can't breathe. I used to panic. Now she walks me through it.
Whenever the avatar is awake,
So if I want to wake Buddy the dog up, I'm just going to pat him on the head.
that means the camera is turned on, and a health advocate employed by Care.Coach can see and interact with its users.
And it's going to make sure that they take their medications, that they come to their medical appointments, that they participate in their rehab, that they open the door for our nursing staff.
Can you tell me what kinds of things you do to help Bill out?
Oh, when he is in pain, I call for help.
Socks even entertains.
Help me look for the items as I call them.
It's peace of mind for his whole family.
Oh, I'm like not nervous like I used to be.
It may sound silly to you. This thing works. And she brought me out of complete depression when I'm alone. Between my wife and her, I got it made.
Imagine a future in which technology has made intelligent, empathetic conversation not scarce and expensive, but abundant and scalable. How would that impact older Americans like Bill, our society, and the healthcare industry? Care.Coach delivers this future today. At this moment, Care.Coach is supporting hundreds of older adults like Bill, who together account for tens of millions of dollars per year in medical expenses. We coach these most psychosocially and medically complex members of the healthcare system, who are typically low-income older adults, supporting them day to day to live their best lives, maximize their independence, and minimize healthcare costs. University of Washington, Stanford, and others have published clinical research showing that the Care.Coach avatar indeed reduces loneliness and depression. To further leverage these personal relationships into healthcare outcomes, we developed an expert system into which we've coded thousands of clinical coaching protocols and care coordination pathways for common chronic conditions and other risk factors. Our avatars deliver these coaching and care coordination protocols not like every other digital health app or chatbot does, but the way a healthcare-trained family member would. After reminiscing with one client about their grandchild's birth, we may coach them through doing their shoulder roll physical therapy exercises. Before playing a client's favorite Frank Sinatra song to relax them for bedtime, we may ask them how they did on their diabetes-friendly diet for the day. And in between heart failure medication reminders, we may talk with them about their volcanic rock collection. These personalized avatar-enabled relationships and interactions have improved our clients' self-care and supported our health plans' care coordination, enabling them to reduce the amount of home care services required and the frequency of emergency department visits. We even have clinical evidence showing improved hospital inpatient outcomes among older adults, which can lead to reduced hospitalization costs. These healthcare outcomes are key to fulfilling our original mission of solving social isolation. By driving return on investment for Medicare and Medicaid health plans, our health plans are incentivized to cover the cost of our service for low-income older Americans who would not otherwise have the funds to pay for any such technology out of pocket. Many of our clients don't even have any supportive family members. Their Care.Coach avatar given to them by their health plan is everything to them. Our current health plan customers together insure well over 20 million lives, and we did 7 figures in sales last year. Even more, machine learning algorithms need data to learn. And our data, just like our avatars, are unique and valuable. The relationships our avatars have built have produced tens of millions of conversational data points. And for understanding the truly natural responses of an older adult population in a healthcare context, we've achieved conversational AI performance measures that surpass Google. We're already profitable, and in the next year, our AI pipeline will halve our cost of goods sold. In addition to deploying an avatar-delivered COVID self-isolation set of protocols last year, we helped our customers' pandemic responses by launching a new product, Care.Coach Video Visits, greatly expanding the reach of telemedicine to individuals who are self-isolating and don't have the tech skills to take advantage of mass consumer telemedicine. We make it super simple with our all-in-one device. And it's not just for telemedicine. Family members love using Care.Coach video visits to connect with their loved ones. We've already raised $8 million in combined public funding from Congress, the National Institutes of Health, and private investors. We're actively hiring across sales, ops, engineering, and research roles, and we'll soon be closing a Series A to accelerate go-to-market and to advance our AI-driven automation systems. So if you're interested in joining us to scale human touch, please get in touch.
Outstanding. All right.
Hello.
Thank you, Victor. All right. So again, let's go around the horn. Start with Nick. Nick, you're up.
Hey there, Victor. Excellent presentation.
Thank
So
you.
my natural question, although I thought that the cat was adorable, my natural inclination was that was kind of cryptic and a little, if everyone's not a cat person, what would we, was there, I wasn't clear if there were actual people on the other side of the conversations, or was it like computer generated, AI? And then the second part of your presentation, when you had the human interaction, there, I'm like, why one versus the other? I would think that an older person with a touch of a button would just like to talk to someone, and someone, instead of having, an animated cat, if I could talk to Susan, did you go away from that for cost saving measures, or did you believe that, full stop. Was that a cost saving?
Great question. Yeah, maybe I should explain the logic behind why it's an avatar. So essentially what I set out to do was solve social isolation with the understanding that artificial intelligence is not really good enough. Nobody's just going to give Siri to their grandmother and be like, great, I've solved the problem. So you need real people. And so in order to provide staffing of real people cost effectively, we have a global team of people who we hire and train and manage called health advocates. And when I went around researching senior care and like home care agency owners and care managers, one of the biggest struggles was even people who are fortunate enough to have the funds to pay for private duty home care, because unfortunately Medicare doesn't cover long-term care. Even those fortunate people, they very often will refuse to pay for these home care services. They won't want them because it's a horrible fragmented experience. A typical home care agency will tell you they need about 7 or 8 different people on staff just to reliably provide 24/7 staffing. And Care.Coach would have the same problem if we just kind of did a straightforward video call to connect with our team. And you wouldn't be able to build as strong continuous relationships. We have people that they have the same avatar, which is their friend, all the way through end of life, multiple years, all the way through end stage Alzheimer's disease, for example. And that's difficult to do with a whole team of 7 or 8 different people. And so the avatar unifies them into a single persona. It makes it easier to build and maintain those relationships. And the other thing is it allows us to seamlessly inject artificial intelligence. So if you believe in the future where we're talking to AI as you would talk to a friend, not like you talk to Alexa or something, but like you can actually see AI as a material augment to the caregiving, the available workforce of caregivers. In that future, machine learning algorithms must have been taught using data They must have learned how to have these psychosocially supportive conversations and relationship building conversations, not just the simple, did you take your medication, yes or no type conversations. And the problem is that the people in organizations like family members, nurses, care managers that are actually having these psychosocially intelligent relationship building conversations, they're not recording all the data that's necessary to train the machine learning models. You know, the chatbot companies are recording all the data, but they're not having the right type of conversations. So Care.Coach is the only company in the world, by having this integration between the human and the AI, that is actually having these conversations and producing the data that's necessary to train the machine learning algorithms. So to answer your question, Nick, which is a great question, it's a hybrid. There's always, for our core product, the availability of health advocate staff in the back, but we've gotten to the point where some of our responses can be produced through a machine learning model that's classifying what the person says. But when that model is of low confidence, it can immediately draw in a health advocate to take over that conversation seamlessly.
Super.
Thank you for that.
All right. So, and next question. Yeah, Nathan.
Yeah, Victor, great presentation. Thank you.
Thanks.
Really blown away. It's really extremely innovative. Two quick questions. The first is, if you have a sleeping avatar, are you able to wake it or activate it?
Yeah, just like in the video, like you just, if you have a sleeping dog, you kind of poke it a little bit to wake it up. So that's exactly what you do. We started out serving an Alzheimer's disease population, so we just had to make the product like super intuitive. I remember the earliest things that happened was one of our first consumer customers. She's the daughter of somebody with end-stage Alzheimer's disease. And this was before we knew how important the user experience of the tablet was. She told me one time she accidentally pressed the button to lock the screen, and the screen turned black. And her father was like, he named his little dog Pony, and he was like, oh, where did Pony go? And he started looking for Pony in the couch cushions, because in his mind, if Pony disappeared from the screen, he must have fallen into the couch cushions. And so it's like, wow, we're not just building a piece of technology here, we're building people's friends. And so we had to build it in an intuitive way. So that's just one example, but we've designed everything to where you don't have to think about, you know, how do you talk, you wake them up how you would intuitively wake them up. And
totally.
and we're also proactively checking in throughout the day to, you know, so you don't have to wake them up.
Sure. Yeah, back in like the back of my head, what my thought is, for example, if you have someone that fell, you can't your tablets on the tablet.
Exactly. Yeah, we pick up on people who fall because we're checking in so frequently, and we'll call out, and we'll even see them on the ground, and we get them help.
Is the tablet itself, or the communications, like I understand there's the video chat, is it only a direct conduit to your care team, or someone that's from your team on the other side of the line, or is the family able to call into that tablet and actually have communication there? Is it?
Yeah, great question. The avatar is staffed by our professionals. It takes multiple weeks of full-time training to actually be a Care.Coach health advocate, and we only select the top 1% of our applicants. So that's a very specialized job. But then I'm glad you asked, because that was a product that we just launched, Nathan, in 2020 called Care.Coach Video Visits. And family members love using that, just like social workers and nurses use that to call in. There's a study by UCSF about how telehealth, telemedicine has helped with COVID and self-isolation, but there remains 13 million older Americans who don't have the technology skills or the Wi-Fi or the device at home. A lot of these people correlate with the low-income population as well, and they're being underserved by telemedicine. They don't have the skills or the setup in the home to use MD Live, Teledoc. And so Care.Coach Video Visits, we provide them this device with an embedded AT&T or Verizon internet connection and super simple interface for the video calling.
Great. Thanks, Victor.
Yeah,
Fantastic. Thank you. Any final questions?
And just one quick question. Truly innovative product, Victor.
Thanks, Blair.
Happy to see it here. How does one acquire an avatar friend? Is it through a prescription from a provider? I think you mentioned something about a health plan prescribing it. Are there ways to get it outside of a health plan?
Yeah, we mostly sell into health plans these days. So there's these things called PACE, or Program of All-Inclusive Care for the Elderly health plans. If anybody listening doesn't know about it and has an older loved one, and you're struggling with this problem that the United States Medicare system doesn't pay for long-term care, you should look into PACE health plans. So that's one of our customer types. And then we are also in Medicare Advantage. So if you are lucky to be in one of these covered areas with one of our customers, then you can get our service for no cost. And if you're not, then please complain to your health plan and ask them to get Care.Coach service for you and all their members. And alternatively, if people find out about us like from this event or our website, we don't turn anybody down. If people need some help to care for a loved one, just give us a call, shoot us an email at hello@care.coach, and we're happy to help. We can set you up for a consumer subscription as well. And then the other thing is, if we're able to work with AARP, there's 40+ million family caregivers in the U.S. who are otherwise very difficult for a company like us to reach through just spending marketing dollars. So, AARP would be a great relationship for us to have.
That's fantastic. Well, again, terrific presentation. Thank you very much, Victor, for this, and great questions from the judges. Thank you, judges, for the insightful interrogations, if you call them that, and great questions on looking back at the models here.